I think it's pretty important because I think there's a lot of people that it impacts, and we have a lot of potential to make people's lives better, help them live a life of meaning, help them get back to activities that they love, help them get back to being with their family members, and helping people being able to move forward in their lives after quite a catastrophic, life-changing experience. I really believe that actually by getting better organised in our administrative stuff and really understanding what it is that we're doing, it's leading to better outcomes, not only for ourselves and our services, but also for the people that we're working with. Goal setting is absolutely fundamental to rehabilitation. In fact, goal setting is fundamental to so many different aspects of life and progress. And it's always been my philosophy that there's always a way that you can improve someone's existence, and there's always a way that things have got better. So I think that that temperament or that outlook of mine automatically lends itself to this sort of work. I remember being sat there probably at my 5th multidisciplinary team meeting of the week with reams and reams of paperwork, trying to make sense of it all, and just realising I wasn't doing the best job that I could do for this client. Although I'm a psychologist, I come from a long line of engineers, all of whom think it's quite bonkers that we still do a lot of these things by hand. And so I've always had a bit of an ear or an eye on the technological side of things. And a couple of years ago, decided to look into goal setting in a lot of detail, and try to find a way that we could make it better, faster, more efficient, and find a way that we'd be able to communicate with teams better all over the country. So that's where it came from. Really came from an organic need within my service. And so we tried to think about what are the gold standard components of goal setting, and how can we build them into one system, one platform, so that it was all in one place and people wouldn't have to struggle anymore with the onerous admin demands. Resources are limited, but actually if we use software and we use technology to take up some of the demand in terms of administrative tasks, it frees up whatever resource is there to focus on the good stuff, which is the clinical work that we should be doing with people to help them get better. It just organises things, so it organises quite a lot of complex data and sort of puts it all in one-stop shop. So it means that it's much easier for people to understand what's going on. So at every level, there's much more clarity, it's much faster, it's much more focused, and it's much more directly helpful for the individual, the service, and for individual clinicians. So what Goal Manager allows us to do is allows people to leave the acute setting with a clear set of goals, with a clear set of steps and objectives and things that people can practically be doing, even perhaps while they're waiting to be referred on or to access other community services. So it just means that people can really get going, and so we don't have this kind of forgotten group of people who really, really want to get better, really want to do something about their condition, that are just waiting. So what Goal Manager does, it allows all of that data to be stored in one place. So out in the community, it's really easy to be able to see what services that individual needs to access in order for their rehabilitation to continue. So it means that more people can continue to be managed in primary care by their GP. And if they're managed in primary care, that means they don't need to be seen in hospital in secondary care. And that means that the people that do need to be seen in secondary care, therefore there's more resource for them. So it reduces waiting times. It means that you can join up services that don't have a physical joint connection between them, so we can link social care services with health services, with education, with vocation, and with individuals at home. And it means that it reduces the need for meetings, it reduces the need for paperwork at meetings because all of it is automatically there on the system. Goal Manager also sends you automatic reminders, and lots of other features are built in just to make it easier for people who are working remotely. So several patients are active on Goal Manager as well as multidisciplinary teams, and they report to us that they really have enjoyed and relished being partners, true partners in their rehabilitation, understanding all the different steps and how it all joins together, seeing how it all links together, and being able to see how their outcomes and what they want to achieve are directly linked to the activities of the multidisciplinary team. So they're able to track their data, and having feedback on your progress is really, really helpful and important to motivation going forward. So it really helps people keep motivated and keep going with their rehabilitation. When you're setting goals with people, generally people don't say to you, my goal is to be able to walk 10 to 50 steps. What they say to you is, my goal is to be able to go to the shop and come back. Or they might not say to you, my goal is to be my depression to be at a normal and average range. They will say, my goal is to feel a bit happier, or to be able to enjoy my children again, or to be able to go out with friends and enjoy that again. So when we talk about recovery and we talk about a full recovery, it's about what is meaningful and valuable for that individual. So this is why the process of goal setting is so important, because it is so individual. What's meaningful and valuable to you might not be meaningful and valuable to me. But Goal Manager really allows us to look at all the different things that might go on in someone's life and really understand in those different areas what's important to them.